Cuts and lacerations. Cuts or lacerations are clean, linear breaks in the skin caused by sharp objects, while lacerations involve jagged tears and are often deeper and more complex. They can result from various causes, such as accidental contact with sharp objects, falls, surgical procedures, machinery, accidents, bites, falls onto rough surfaces, or blunt force trauma. Common signs include bleeding, pain, visible wound characteristics, swelling, and redness. While minor cuts can be treated at home, deeper cuts and lacerations require medical attention to prevent infection and facilitate proper healing, often involving cleaning, closure with stitches or staples, and scar minimization treatments. Burns. This is when your skin gets hurt because of heat, chemicals, or even electricity. Burns can be very serious, so it's important to be careful around hot things. Wear proper clothing when needed, like oven mitts, and stay away from chemicals and electricity unless you know what you're doing. Concussion. This can happen from a hit to the head, and it can make you feel fuzzy and confused, or even give you a headache. It's important to wear a helmet during sports or activities where you could fall and hit your head to help prevent this. Dislocation. When a bone that is normally fixed in its socket pops out, it can hurt a lot and make it hard to move this joint. To avoid this, try to warm up your muscles before exercising, stretch regularly, and don't overuse any particular joint. Tendinitis. Tendons are like little strings that connect your muscles to your bones. If you use a lot of muscles, the tendon can get irritated and sore. Stretching and taking breaks from activities that use the muscle a lot can help prevent this. Bursitis. There are fluid-filled sacs around your joints that act like cushions. If you bump or overuse a joint, one of these sacs can get inflamed and sore. Just like tendinitis, stretching and taking breaks can help prevent this from happening. Sprains and strains. A sprain happens when a ligament gets stretched or torn. Ligaments are tough bands that connect your bones at your joints, like your ankle or knee. Imagine them as rubber bands holding your bones in place. If you twist your ankle the wrong way, you might stretch or tear one of these rubber bands. A strain happens when a muscle or tendon gets stretched or torn. Muscles are what makes you move, and tendons are like strong cords that connect your muscles to your bones. Think of your muscles as the engine and the tendons as the cables. If you use a muscle too much or move too suddenly, you might overstretch or tear one of these cables. Plantar fasciitis. This is a painful foot condition caused by inflammation of the plantar fascia, a tissue band supporting the foot arch. This inflammation results from excessive stress or pressure, particularly in the heel area. People who are often on their feet, such as athletes or those with standing intensive jobs, are prone to this condition. It can also be triggered by sudden activity increases, tight calf muscles, or inadequate footwear lacking proper support. Tennis elbow. This is a condition caused by inflammation of the tendons connecting forearm muscles to the bony bump on the outside of the elbow. This inflammation results from repetitive gripping or wrist movements, common in activities like racket sports, weightlifting, or using tools like screwdrivers. The pain typically occurs on the outer side of the elbow and can worsen with gripping or twisting motions. While overuse is the primary cause, sudden forceful movements or traumatic impacts to the elbow can also trigger tennis elbow, though less frequently. Golfer elbow. This affects individuals who perform repetitive motions, straining the inner forearm muscles, not just golfers. This condition targets tendons attaching forearm muscles to the inner bony bump of the elbow, responsible for wrist and finger flexion. Symptoms include dull ache or tenderness on the inner elbow, worsening with gripping or pulling activities like swinging a golf club or using tools. Overuse from repetitive motions that strain inner forearm muscles, such as forceful gripping or wrist flexion, is the primary cause of golfer's elbow. Shin splints. This injury is common among runners and those engaging in high-impact activities. This condition arises from inflammation of muscles, tendons, and bone tissue along the inner edge of the shin bone. Overworked leg muscles can develop tiny tears in fibers and surrounding tissues, resulting in dull, throbbing pain along the shin bone. The discomfort typically worsens with running or jumping and may include tenderness and mild swelling. Activities involving repetitive high-impact forces on the legs increase the risk of developing shin splints. IT band syndrome. This is common among athletes and fitness enthusiasts. The iliotibial band, the IT band, is a thick tissue running along the outside of your thigh, stabilizing hip and knee movements. Repetitive motions causing friction between the IT band and the bone can lead to irritation and inflammation, resulting in IT band syndrome. Symptoms include a dull ache or burning sensation on the outer knee or thigh, worsening with activities involving repetitive hip movements. Patellofemoral pain syndrome, commonly known as runner's knee, occurs due to irritation or inflammation of the cartilage beneath the kneecap and surrounding tissues where it moves against the thigh bone. This disruption in kneecap tracking leads to discomfort, exacerbated by repetitive knee bending and straightening during activities like running, jumping, or squatting. PFPS symptoms include a dull ache or throbbing pain around the kneecap, especially with activities such as running, jumping, squatting, or stair climbing. And it may also involve feelings of knee instability during movement. Fracture, a break or crack in a bone ranging from a hairline fracture to a complete break with multiple pieces. The force required depends on bone strength, bone density, and the direction of impact. Fractures can result from falls, car accidents, or blows to the bone, with force needs varying by bone strength and type of fracture. Strong bones like the femur may need high-impact events to break, while weaker bones like the fibula can fracture from twists or falls. Athletes can develop stress fractures from repetitive strain during activities like running or jumping, often in the lower leg, foot, or spine. Conditions like osteoporosis weaken bones, increasing fracture risk even with minor impacts. Contusion, more commonly known as a bruise, it results from blood collecting beneath the skin's surface due to a direct impact on soft tissues. While less severe than a fracture, a bruise can be painful and tender. Contusions often occur from falls, bumps, or sports-related contact. In rare cases, more significant trauma can cause deeper bruising within the body. Symptoms of a contusion include initial sharp pain that dulls over time, along with skin discoloration that changes from red to blue and purple as the blood breaks down and is reabsorbed. Eventually, the bruise fades to yellow before disappearing completely. Swelling and tenderness in the affected area are also typical with contusions.